Hello parents, myself Dr. Anupriya. This course is a parent guide about how to swaddle your baby. So we'll learn about what is swaddling, why do we need it, what to use, how to do it. So swaddling is nothing but snugly wrapping the baby in a thin blanket or a specially designed swaddle, creating a safe, secured and comfortable environment. The primary goal of swaddling is to mimic the feeling of tightly being held inside the tummy, which can calm and soothe the baby. Swaddling has been practiced for centuries in various cultures, though the beliefs or the techniques may be a little different. It doesn't mean that you need to swaddle your baby 24/7. You can swaddle when the baby is falling asleep. It is required only in some specific situations to soothe the baby. Now, benefits of swaddling. Swaddling can help babies sleep longer and more sound by reducing the chances of startle reflex, which can wake them up often. Secondly, it reduces the startle reflex. So, startle reflex is nothing but an involuntary movement which wakes the baby up and disrupts the sleep and makes them feel insecure. So, swaddling suppresses this reflex. Can be calming and soothing. So, the snugly fit wrap can provide a calm, secured and safe environment for your baby, mimicking the confined space of the womb. Can also help in colic. Some parents say that it helps their baby soothe during colic pain, though it's not a cure. Swaddling basically helps your baby in the first few months, that's the 4th trimester which we consider, when the baby is learning how to live in the present environment. 9 months they were inside the womb, so the baby will give away slowly. So swaddling is one of the means to give an environment which mimics the womb. Now the safe swaddling techniques. These are very important as a parent for you to know before you swaddle your baby. First is hip healthy swaddling. This is absolutely crucial. The swaddle must allow the baby to bend up and out at the hip. Tight swaddling that forces the legs to be straight can cause hip dysplasia, which is a serious condition. Ensuring that the baby doesn't get overheated. So use a thin, breathable fabric and make sure you are not overdressing your baby under the swaddle. Monitor for the signs of overheating like sweating, flushing, proper tightness. So the swaddle should be snug around the baby's arms to reduce startle reflex. However, it should be a little loose at the chest so that baby is able to breathe properly. You should be able to put 2 to 3 fingers between the swaddle and baby's chest. Lastly, back sleeping. Always and always place your baby on their back when the baby is put to sleep, even when swaddled. This is essential to reduce the risk of sudden infant death syndrome. Now, swaddling material, breathable fabrics. Opt for lightweight, breathable materials like cotton or muslin to avoid overheating. Size and shape of swaddle blankets. Use a large enough square or rectangle for allowing proper wrapping. You can use swaddle blankets with velcros or zippers, but ensure they allow hip flexion. Avoiding loose blankets. Whenever you swaddle your baby, make sure you don't put any loose blanket in the baby's crib, as they pose a risk of suffocation. Swaddle replaces the need for loose blankets. Now a step-by-step guide to how to swaddle your baby. Lay the blanket in a diamond shape on the bed. Fold down the top corner. Then place your baby on their back at the center with their shoulders just below the fold. Bring one arm down along their side and wrap that side with the blanket across to the other side, tucking it under the opposite arm. Fold the bottom corner of the blanket up and tuck it behind the baby's leg, ensuring that babies can move their hips freely. Bring the remaining arm down and wrap the other side of the blanket across the body, tucking in any excess fabric. Ensure that the swaddle isn't too tight around the chest by checking if you can place easily your 2 to 3 fingers between the swaddle and baby's chest. Also, the hip should be able to move freely. Now, timeline for swaddling. Swaddling is most effective and beneficial in the first few months of life when they are newborns, that is up to 2 to 3 months of life. As the babies grow, they gain more control over their movements and may resist swaddling. It's crucial to stop swaddling when you see the signs that baby has started to roll over or is trying to roll over, as it may increase the risk of suffocation and restrict their movement. Some babies may not like swaddling, and that's completely normal. It's not that every baby has to be swaddled. It's a situation specific aid. So if your baby gets soothed by swaddling, you can swaddle your baby. Situations where swaddling can be useful. First, during sleep. Swaddling can make your baby sleep for longer periods and more sound, especially during the naps and nights. Swaddling can help keeping a baby calm during any kind of procedure like diaper change or any medical examination. Swaddling can particularly be helpful for those babies who are colic or they startle easily. Now, when do we stop swaddling? When baby can roll over. Once you see your baby attempting to roll over, you need to stop swaddling. That is around 2 to 4 months of age. A swaddle baby who rolls over has a higher risk of SIDS. If baby is sick or has fever, swaddling can trap the heat and make it harder for the baby to regulate their temperature. If baby has hip dysplasia or any other medical conditions where your pediatricians have advised not to swaddle, you need to avoid. Also, avoid swaddling when your baby is showing signs of overheating or when you feed your baby, as it can restrict the movements.